Hi, I'm Dr. Jill Alldredge. I'm a gynecologic oncologist, which is a specialist who takes care of women with gynecologic cancers, including ovarian cancer. Our mission at Daniel Ovarian Cancer is to increase your access to knowledge about ovarian cancer and to empower you to pass that information along to others. We want to teach you the symptoms that indicate ovarian cancer and how to advocate for yourself when you're seeing your physician. We want to provide clear resources for you and avenues for you to dive a little deeper. We also want to make you aware of risk factors and what you can do about those risk factors. It's important to understand that there is no screening test for ovarian cancer. The Pap smear test looks for cervical cancer but does not screen for ovarian cancer. There are exams like pelvic ultrasounds and a blood test that can be done on patients who are really high risk, but even that is not a good screening test. And there are no screening tests for the general population. In patients who are very high risk, we can consider those as screening tests, and it's important to understand what may put someone at an increased risk of ovarian cancer. So the highest risk population is one who has an inherited mutation. So this would include BRCA, 1 or 2, or a handful of other inherited family cancer mutations. Also, having a family history of breast or ovarian cancer, either on the mother or father side, especially in patients of Ashkenazi Jewish descent. Patients who are obese or overweight do have some increased risk, and patients who have never had a pregnancy or have had a pregnancy later in life may be at some increased risk. And then any distant family history of ovarian, breast, or colorectal cancer, especially if there are multiple of those cancers within a family, may have some increased risk as well. If you have any of these risk factors, your primary care physician or your OBGYN can refer you to a genetic counselor. And this allows that counselor to perform blood or saliva tests to look for any of these mutations. If you're a woman with a BRCA mutation or a hereditary ovarian cancer syndrome, we encourage you to see a specialized gynecologist or a gynecologic oncologist like myself to discuss all of the options that can reduce your risk of developing ovarian cancer in the future. In this high-risk population, we can use things like blood tests and ultrasounds to screen, but even these can be limited. So we do consider at times doing a minor surgery to remove the fallopian tubes or the fallopian tubes and the ovaries, depending on someone's age and whether they're done with bearing children. So there are additional options for women with those high-risk syndromes for breast cancer reduction as well. So again, I encourage you, if you do have one of these high-risk situations, to see a genetic counselor, and then we can get you the correct option to reduce your risk of ovarian cancer. So what do women do if they don't have a family history or they don't have one of these risk factors, but you still want to do something to actively reduce your risk of ovarian cancer? I encourage you again to talk to your primary care doctor, talk to your OBGYN. We can shut down the ovaries using birth control pills, and that is an effective option in many women, but this needs to be reviewed with your doctor to make sure you're a good candidate. We also know that things like the hormonal patch, the hormonal vaginal ring, or the hormonal intrauterine device can also be used to reduce risk. For example, women who use a birth control pill for 5 or more years have a 50% lower risk of developing ovarian cancer compared to someone who never used oral contraceptives. So this can be an effective and easy to access option. The medications aren't right for everybody, so it's important to discuss this with your doctor first. Also, all women who have completed childbearing or are done raising children, regardless of their family history or risk, should advocate for themselves to have their fallopian tubes removed at the time of another pelvic surgery. So if you're having a cesarean section or you're having a hysterectomy for another reason, this is a time we should also take out the tubes. And if you're over 50, we may consider taking out the ovaries as well to reduce your risk of future ovarian cancer. So if you or your loved one has recently been diagnosed with ovarian cancer, you should seek care with a gynecologic oncologist. A specialist in these types of cancers can discuss with you treatments that may be necessary or screening that can be done. Women have better outcomes when they see a specialist, so we do encourage you to advocate for yourself to get connected with the right care. Additionally, any woman who has a diagnosis currently or in the past of ovarian cancer, if you have not had genetic testing, you should. Seeing a genetic counselor and getting a saliva or blood test if you have or have had ovarian cancer is very important. This helps you guide family members in these risk reduction options and also can affect your treatment. So again, please address this with your physician if you have not had this, because it can impact your care and the care of your loved ones. I hope you take this information as a guide for yourself, but also use this information to educate those around you. Knowledge of this disease is so important for both prevention, and awareness is key to saving lives. So let's stop this disease from being silent. Thanks.